Honestly, like, it was so little that I didn't even remember it when I heard the word fentanyl.
Fentanyl frequently makes headlines as it invades every part of society, but it's not always talked about, if at all, in the classroom.
In tonight's special report, Elizabeth Matthews takes a look at a new law that would change that.
For Lilia Paradati, the topic of fentanyl became a personal one about 2.5 years ago.
My mom, her boyfriend passed away from fentanyl, and she had found him in his apartment. Unfortunately, he had already passed.
The untimely death sent shockwaves through her family and got her thinking.
I kind of questioned myself, and I was wondering what even is fentanyl, because at that point I hadn't been taught a ton about it in school. During that year and during that time I had my health class, but I was only taught a very, very small amount about fentanyl.
That's why Lilia made increasing education about fentanyl the goal of a social studies project she had at Naperville Central High School last year.
My action was creating 2 bills that have helped get my point across. The first one is obviously about fentanyl education in schools.
This House bill, it basically requires high school health classes to teach about the dangers of fentanyl, to teach about recognizing the symptoms of an overdose, and more importantly, how to treat that overdose if you see one happening.
After being contacted by Lilia's teacher, State Representative Janet Young-Rohr worked closely with her to turn those bills into laws. The second bill requires school nurses to have Narcan in their offices.
I think it's a great idea.
Laura Fry is the executive director of the harm reduction organization Live for Lolly. She says a drug education gap can have deadly results.
I'm talking to kids who have no idea what fentanyl is, kids that have no idea what naloxone is, and that they should carry it. And then all the way on the other end of the spectrum, oh yeah, I know all about fentanyl, I like that.
Fry says we need to close that gap and make sure kids don't just learn about drugs on the street.
That is not where we want kids to get their education. Children are curious. And the moment we say to them, 1 pill will kill you, and they happen to try it and they don't die, then we're all liars. So things are impulsive, nothing's going to happen to me.
But statistics show just the opposite.
What we are finding, because we test people's drugs, we are finding fentanyl across the board. We have tested and found it in all press pills. We have tested and found it in LSD.
In 2022, the Cook County Medical Examiner's Office saw a record number of opioid-related deaths, the vast majority traced back to fentanyl. DuPage County reported 150 overdose deaths that same year, with more than 2/3 of those also tied to fentanyl. It's a trend lawmakers like State Representative Young-Rohr have been following closely.
What we've seen over the past decade especially is just like a huge rise in opioid overdoses, and fentanyl has really become a part of that.
Much like Lilia and her family.
So when you put it into that curriculum, then it makes sure that, you know, when you're going through high school, that you'll definitely get this this piece of education.
Both of the bills State Rep Young-Rohr and Lilia worked on together were signed into law by Governor Pritzker late last month. They both take effect at the start of the 2024-25 school year. Elizabeth Matthews, Fox 32, Chicago.